Hello, my name is Oscar Breen, and today we will be going over a parent's field guide to retinoblastoma. Firstly, what is retinoblastoma? Well, retinoblastoma is a rare form of cancer that grows from cells located in the retina, which is the light-sensitive tissue in the back of the eye. These cells, in healthy individuals, will stop growing after a certain age. However, in people with retinoblastoma, this is not the case, and some cells become cancerous. These cancerous cells can then cause tumors to form in the back of the eye, possibly impairing vision, causing discomfort, and leading to many other problems if not properly dealt with. Luckily, treatment for retinoblastoma is currently very reliable and leads to very high success rates. But let's take a more in-depth look at the cause of retinoblastoma. As of the current state of retinoblastoma research, only 40% of all cases have a known genetic cause. This cause is a mutation in the RB1 gene, a gene that codes for a protein called PRB, which acts as a tumor suppressor. When even one of these genes are mutated, less tumor suppressors are created and the risk for cancer increases. Now let's look over some possible treatments for retinoblastoma and see what might be best for you. The treatments for retinoblastoma, not including surgery, are cryotherapy, an attempt to bring the current tumor to levels below the survivable bodily temperature; thermotherapy, which is similar, but instead of reducing the temperature, it increases it, essentially burning the tumor with a laser to eliminate it; and gene therapy and chemotherapy, which we'll be going over in depth on today. Chemotherapy. Chemotherapy is currently the most common treatment for retinoblastoma in the early stages and has an extremely high success rate and is a highly refined option. One form of chemotherapy administered is IV chemotherapy, or intravenous chemotherapy, meaning through the vein. As you can see from the diagram, the chemo is administered through the femoral artery, through a catheter which then follows that artery all the way to the ophthalmic artery, right behind the eye. This allows the treatment to attack the tumor as directly as possible. There are many different types of chemo drugs, but generally they work like this. Cancerous cells are cancerous because of their rapid expansion and replication of themselves, growing larger and larger as time goes on, inhibiting normal bodily functions. So chemo is a drug that targets dividing cells and inserts themselves into them to damage their DNA to such an extent that it induces cell death, or what's known medically as apoptosis. This procedure can reduce the size of the tumor, or in the best cases, completely eliminate it. However, it should be noted that chemo does not discriminate in its targeting of dividing cells, and side effects of chemo can cause harm to the body's other fast-dividing cells, such as hair, bone marrow, or skin. But in the case of retinoblastoma, it can often be administered in direct enough ways and in small enough samples to where a lot of these side effects are diminished. The next treatment I'm going to talk about is gene therapy. Gene therapy is a treatment that utilizes gene editing abilities to perform a task. In a lot of cases, this can include enzymes such as CRISPR-Cas9 to directly locate and change a selected gene. This can be used to block, promote, or add different genetic codes. The specific gene therapy that is being researched and treated as of now is something called oncolytic adenovirus therapy. This therapy works by editing the gene sequence of a common virus. It edits it so that all of the harmful elements that the virus would have coded are deleted and replaced instead by the genes the scientists want it to code. In this case, they want the virus to detect a protein called E2F-1, a protein released in abundance by cancerous cells. So when these adenoviruses are introduced to the body, they target solely these cancerous cells. They then enter these cells and replicate so much as to call the cell to lyse, or pop. This genetic therapy has the benefits of not causing side effects like the non-targeted chemotherapy, meaning only the cancerous cells are affected. However, unlike gene therapies for other conditions, this does not edit the host DNA, and thus the person will still live with an increased risk of cancer. Even though these treatments have their downsides, they are proven successful. as retinoblastoma has one of the highest survivability rates of all cancers, being 95% in medically developed countries. So why discuss retinoblastoma at all? Well, there is a major issue with it. It has to be diagnosed early for these treatments to be successful as they are. If it isn't, it can require major surgery, including removal of the eye, and in hereditary cases, this would often mean both eyes. But especially if left too long without treatment, retinoblastoma tumors can spread to other parts of the body where it becomes much harder to treat, and the likelihood of it becoming fatal increases drastically. So if you or a loved one has recently received a diagnosis for retinoblastoma, or you're just curious after hearing about your doctor screening your children for it, I highly recommend that you seek out genetic testing to see if you may be susceptible to retinoblastoma in the future, or if the gene may be likely to be passed on from you to your children. Thank you for watching and helping educate yourself on the issue regarding retinoblastoma.